Ladies and gentlemen, it is my honor to present my topic in Imcas 2023. Sorry. I'm Dr. Lin from Taiwan, member of Supervisory Board of Taiwan Society for Wound Care. The purpose of my topic is to talk about the mechanism of action of collagen dressings in wound healing, then to introduce the treatment algorithm and demonstrate the method of application. Finally, the case details are shown. Collagen is a glycoprotein with triple helix structure. Collagen has 29 kinds and 25 different structures, and different structures have different functions. The main difference in structure is in the alpha chain sequence. The most common type of collagen is in the human body is type 1, which is the main material of skin, bones, and tendons. The various stages of collagen turnover produce different forms of collagen that stimulate receptors on the cells, and the stimuli mediate signals for the cell's response. The most studied receptors are integrins. The integrin family are collagen receptors, RGD receptors, laminin receptors, and leukocyte-specific receptors, comprising 24 heterodimers. The most studied integrin is the collagen receptor. This table shows the sequence of the receptor binding sites in different types of collagens. The most abundant collagen sequence is GFOGER on type 1 collagen, and the receptor is alpha 1 beta 1, alpha 2 beta 1, and alpha 11 beta 1. When GFOGER on type 1 collagen binds to integrins on cells, it activates the ERK-MAPK pathway for downstream effects such as adhesion, migration, and proliferation. This is the first mechanism by which collagen dressings help wound heal. On the next slide, I start talk about the second mechanism of collagen dressing. This is a basic knowledge of wound healing. Under normal wound healing conditions, protease levels in the exudate are within the normal range, which help cells to function properly and support cell growth in the extracellular matrix. However, when the level of protease is too high, these proteases will damage the cells and cleave extracellular matrix, thereby delaying wound healing, causing the wound to deepen and expand, making it difficult to heal. Proteases, especially MMP, are closely related to wound healing. As the picture shows, during normal wound healing, MMP levels initially increase and then decrease. However, during chronic wound healing, MMP levels are high up to the sky from start to finish, which is one of the reasons why wound healing is affected. The collagen degradation pathway is a stepwise process. Collagenase activation by MMP3 is the first step, which then initiates collagen degradation by the collagenase MMP1. Once the initial fragmentation of collagen fibril occurs, gelatinase, which is MMP2 or 9, further cleave the collagen into smaller peptides. And in comparison to acute wound fluid, MMP levels in chronic wound fluid has elevated 10 to 100 times in collagenase and gelatinase, which affect wound healing. So, collagen dressings in wound management buffer wound exudate and are bioreactive to cells. This is the two main mechanisms why collagenase help wound healing. The first is the buffering effect, is the attenuation effect of excess MMPs on the exudate through its own decomposition. Next is receptor binding sites in collagen help cells in wound healing process. These are recommendations for collagen dressings. Most conditions on wounds are applicable except exudative wounds, wounds with infection and vasculitis, poor wound bed conditions, and sensitive to collagen. And this slide shows the treatment algorithm. Before application, we prepare the wound bed after adequate debridement and maintain wound hygiene. Negative wound culture reports are favorable. After application, prophylactic antibiotics and secondary dressing are recommended. In my practice, there are generally 3 application methods to secure collagen dressings. If the wound can be closed with primary closure, an appropriate volume of collagen dressing is wrapped in directly and help wound heal. This guy had a motorcycle collision on his knee, but in emergency room, the doctors closed primary, but the wound healed after several days. So this guy come to my outpatient department, and we take care his wound by for several days to control inflammation. And after the wound is stable, we use collagen dressing to help the wound heal. And on extensive wounds like this guy, place a non-adherent dressing over the collagen dressing before anchoring suture is performed, because the wounds on the leg is not easy to secure, because leg we need to move. So non-adherent silicone dressing is applied and secured to help the collagen dressing in place. And on tiny wounds, adhesive tape is used to hold collagen dressing in place to help wound healing. So in this slide, I show a difficult case. This woman is diagnosed of pyoderma gangrenosum, and applying collagen dressing in this case is a new try, because a series of wound management to control inflammation and maintain wound hygiene is critical, and this wound heals smoothly after skin graft. Use of collagen dressing is a new concept in wound management. Barriers to use include lack of understanding of benefits, difficulties with dressing change procedures and stocking, limited evidence of use, and lack of cost-effectiveness data. There is more work to be done, such as education efforts and evidence for use. I hope you learned that collagen dressings affect wound healing by modulating MMPs through self-decomposition, buffering MMP activity. Collagen dressings are bioresponsive to wounds via the ERK and APK signaling pathway. Thank you for your attention and Happy New Year.